One of the things I can tell you, our projections show that there's going to be several times increase over the years and as we expand in the value of the company. This means any shareholder investing now and selling their shares, for example, 5 or 6 years from further on, will reap a return several times more than they invested because of that growth. And that is what many investors are being attracted to. I went to medical school in India in 1991, and that was the place where I felt challenged because I found very high quality care being delivered at a very low price, and I wondered how that was done. And at the time, the healthcare of Kenya was not even in that good a shape. And so I remember as a young student feeling that one day this should also come to Kenya. And I spent 5 years in India, and I learned a lot at the time, and I eventually became a doctor and eventually got my qualifications. But then when I came home, I remembered the impact of what I had seen over the 5 years I had studied in India. And I felt, no, this is something that Kenya can benefit from. And one day I felt this is the right time. After all those years of experience, it was time to come up with a vehicle, to come up with an institution that would deliver high quality, low cost services to the people of Kenya. And that is when Miliki Afya was born. And it was specifically designed to serve the ordinary mwananchi, to serve the people of Kenya, who are the majority anyway, and who are struggling every day with finding access to good quality services at a price they can afford. But because this was going to be a difficult model to pull off, we decided instead, before we just jump into it, we decided to prepare for it. So we hired a consultancy firm to research for us the viability of coming up with such a model, and to help us understand what is it going to take for this model to work. What kind of inputs do we need to create? What kind of services are being desired by the people at the level at which we are serving? This research took 2 years because of how complex it was. But eventually, we realized that it is possible to be done. Eventually, we came up with a formula that would be able to deliver this high quality care we had been talking about, that which I had seen in India. It was possible to deliver it to the average Kenyan, to the Kenyan people. And Miliki Afya started. In the beginning, nobody believed, by the way. In the beginning, nobody believed that this could be done. In fact, we looked for partners many, many times, over and over again. And to start, I had to sell my house because I did not have money to start. And the people I was approaching to give me money did not believe that this kind of healthcare could be delivered. So I had to take a risk. And I had a small piece of land, and I was building a house to move in my family, and I made the decision that it is better that we get the seed capital from that piece of property. And we sold it, and I sold it off and got the seed capital for the first clinic in Gom. And that clinic succeeded very much from the first day. And between the time Gong Clinic began and today, which is 18 months, we have treated over 41,000 patients. This is a testament to the fact that the service combination we had provided of high quality, low cost had resonated with the people in Gong area. And as soon as we got off the ground and the success began to be experienced, we began attracting attention. People began taking an interest in what we were doing. And the one organization that came on board with us was Acumen Fund. Acumen Fund is an investment firm from New York and from the United States. And they're very unique in their way they invest, because they invest in organizations that have a social impact, that have community good. And that is what we were doing. We were delivering good to the community. The biggest challenge was, how do you keep such a clinic operating month after month after month, year in, year out? It may work today, but what about tomorrow? What about as the various market forces and economic factors come into play? That was what we had to understand. So that as we spend on our inputs and as we create our inputs, those inputs had to go hand in hand with the prices that the patient could afford, in a balance that allowed each center to stand on its own and each center to be sustainable over time. And that's why it took 2 years, because that kind of research was not going to happen overnight, because we had to work the numbers to the smallest detail. And eventually we did. Our doctor's consultation is 100 Kenya shillings. The average consultation in more higher end medical facilities is between 1,000 and 2,000. We charge 100 Kenya shillings. The disparity is actually quite big. The reason we do that is because we believe consultation is the discussion you will have with the doctor. That is where the care begins. For us, it is more important that you reach the doctor. And that is why our entry fee at consultation is so low, so that you get to see the doctor. One of the things we found during our research was that a lot of Kenyans, when they are not feeling well, will bypass the doctor and go to other maybe directly to the end product, like a chemist, for example. And chemists are good because they provide us with very important medications. But in the process of arriving at a diagnosis, it is important to follow the medical continuum, the value chain, where you have to undergo a consultation and a physical examination and an investigation, then you arrive at the right medication. But because each of these steps have become so expensive, sometimes people actually bypass the whole process. And that's why for us we felt, let us reduce especially our consultation to encourage our patients to come and have a conversation with the doctor. Because it is in that conversation that the doctor will pick out certain salient features about what the patient is talking about. And that will help the doctor arrive at a proper diagnosis. Our typical average cost per visit, what we call average cost per visit, meaning door to door. Okay, you come in, you've done everything, you go out. It will range anywhere from 700 shillings all the way to about 1,500 shillings, depending on the severity of the disease. The sicker you are, naturally the more care you will get and the more it will cost. But it is very rare for us, for a patient to even hit 2,000 bob for an entire visit. And an entire visit means the doctor, all your tests, plus your drugs. That's what we call average cost per visit. So it doesn't necessarily go by disease, but in the 41,000 patients we have seen, the average cost per visit for us is 1,100 shillings. So if you take all the cost of the 40,000 divided by 40,000 patients, you will get it, it'll sit at about 1,100 bob. Which means with 1,100 shillings, it ranges between 700 and 1,200 shillings. All costs inclusive. In many cases, that is not even consultation. You haven't even consulted the doctor. We have 3 international PE funds who are in discussions with us, and we have another 6 or 7 local ones as well. We also have local individuals who are also business people who are interested also in investing and helping us to grow this vision. So the interest is there. We have quite a big interest right now. What is the future of Miliki Afya? Because it is important to understand that future. Because we've started something good, but it has to have a future. There are several aspects to the future of Miliki Afya. The first thing we want to do is educate people about their health. Now, we have a program we have launched called Miliki Afya Yako, which means prosper your own health or take charge of your own health. Because we realize in the straightforward medical practice, doctors wait for patients to come to them. You sit in a room with a stethoscope and you wait for a sick patient to present. But as an organization that is impacting the community, we have to go beyond that. We have to go to the point where we are educating the patient and telling them, did you really have to come to the clinic? The condition you presented with, is it preventable? Is it an acute condition or is it a chronic condition? If it is acute, how did you catch it? Is it something you ate? Did you expose yourself to certain environmental factors that made you susceptible to it? Did you travel to a certain place and not take preventive measures? We are beginning to educate our patients and our people so that we encourage people Miliki Afya Yao to take care of their health. That is our newest department, our Health, Education and Wellness department. We have certain products within our clinics that a healthy patient can walk into the clinic and say, I am here to know the status of my health. You don't have to be sick to come to Miliki Afya. In fact, we are encouraging people, come before you fall sick. Come and check yourself once or twice a year. Miliki Afya Yako, by coming to the clinic and checking yourself. We are doing that even in communities. We are going out and working with county governments and helping them educate their people and teach them about management of health and prevention of these conditions. Those who do have chronic diseases like diabetes or hypertension, we are teaching them how to manage these conditions so that you don't get what we call breakouts. So that if you have diabetes, your sugar levels remain managed. If you have high blood pressure, your blood pressure levels remain managed. To avoid the fluctuations we often see when patients are not educated about their health. We want to empower the Kenyan people to take charge of their health, to control the health even before you get to the doctor. And that is a program we are very proud of. And that is a program we are now putting a lot of our attention in. As we expand, you're going to be seeing newer services so that we can reach more and more people in deeper and deeper parts of the country. We also want to set up a mobile clinic platform because there are some areas that may not be amenable to a physical facility. It doesn't mean we cannot go there. We'll applaud our First Lady for coming up with the Beyond Zero campaign because she has realized that there are certain places that you just have to go in a mobile fashion. We want to help in that area and participate in that area so that we reach the farthest and the deepest place where Kenyans are and where they are lacking medical services.